Welcome back, everyone. Well, as many of you know, there's a global threat out there, the Zika virus. And while it's very easy to say, oh, it's only in Florida and outside of one little community in Miami, or it's just in South America, it's just in Mexico, it's just in Puerto Rico, it's important that we're well educated about this, because in many cases with things like this, prevention is really the key. So when we discovered that there were two experts in our area about the Zika virus, we invited them on to talk about it. And joining me today is Kathryn Mitchel, who's with the March of Dimes, and she's a maternal child health director. Welcome, Kathryn.
Thank you.
Very nice to have you here. And Jennifer Ryan, now this is a title I have to work on, Manager of Infection Prevention and Control Program for St. Peter's Hospital.
Yes.
Welcome, Jennifer.
Thank you.
Very nice to have you here. Jen, I want to start with you. The Zika virus, when was it first discovered? And how did it sort of all of a sudden find its way to where it is now?
That's actually a great question. It started, we first knew of Zika virus in the 1940s in Uganda.
Wow.
There was African activity as well as in the South Pacific Islands with Zika. But I really truly think the reason we hear more about it nowadays with an explosion, frankly, in the last year, is through the work of our prenatal prevention, and medicine has improved over the years, so now we can identify it more rapidly when we see a cluster of birth defects.
Got you. Now, this is a devastating virus. It affects children in so many ways, and it's carried by both men and women. Kathryn, in your role with March of Dimes, you know what I want to do first? Tell us a bit about why the March of Dimes is involved in this, and it has something to do with the mission, right?
Yeah, so talking about Zika is really important to us because our mission at the March of Dimes is to improve the health of babies through the prevention of preterm birth and then birth defects, which is where we really roll in Zika and infant mortality. So this is really important to us because of its impact on pregnant women and their unborn children.
Got you. Now, both of these ladies live in our area, right in the capital region, and that's why we asked them to come on, because, you know, there are things that we can do just to keep our eye out, because this virus can be transferred as easily as someone getting bitten by a mosquito in any of the places that I mentioned earlier, flying into Albany and transmitting it to someone else, or just carrying it themselves. Obviously, the most at-risk section of the population are pregnant women. However, as you were telling me, men can carry this, correct?
Yes, it's true. And we know that 1 out of every 5 folks who are infected with Zika actually show symptoms. So there's more folks that are able to carry it and spread it than actually are symptomatic.
Wow.
The symptoms themselves include fever, joint pain, rash, and conjunctivitis or pink eye are the main symptoms, as well as a headache. But we really want to stress the importance of prevention. So mosquito repellent. We want to be careful in regards to intimate relations with someone. For pregnant women, we suggest if your partner has been in an area that's endemic and you describe those, we would encourage them to either abstain or use condoms to avoid the spread of Zika.
Right, because it can be sexually transmitted, which you don't realize. And again, you know, when you were listing the symptoms of things like joint pain and fever and headache, that's associated with so many different types of viruses. So, you know, if you have a headache, you don't panic. But it's important to understand the symptoms. Pink eye is an unusual one for something like this, right? And would you explain, when someone does get a virus, right, it can infect their bodies, but then their bodies can produce antibodies, right? So that you may only have the visual symptoms of it for a period of time, and then it can stay in your host, you acting as a host for that virus, correct?
Yeah, that's correct. Jen can probably speak a little bit more too.
Yeah, the body is exposed to viruses all the time, and we have natural ways of defending against them, whether it's your stomach and your saliva, your skin protects against infection, keeping intact skin. And when we are exposed to something like a virus or a bacteria, we produce antibodies to try to fight it off. There's different types of viruses. There's viruses cause colds. Viruses cause something like hepatitis or
Yes,
HIV.
right.
So there's
That
a
stay with
wide
you.
variety of infections that viruses can cause. Surprisingly, Zika, except for unborn children, causes a very benign illness, maybe 4 or 5 days, doesn't require hospitalization most times, but it's those infants that have yet to be born, it impedes upon their development. So we're looking at something called microcephaly,
Right.
where the brain doesn't fully develop or the head doesn't fully develop. There's also blindness, deafness, other neurological deficits, and can even lead to stillbirth.
Well, this is very serious. Now, the March of Dimes, I'm sure, is very focused on some preventive measures. Tell us about those.
Yeah, so we're doing a lot of educational campaigns, really trying to get the word out there, making sure people know signs and symptoms, and talking a lot about what are the side effects that you could see if you are pregnant and you do contract Zika. And all that information can be found on the March of Dimes website. In addition, we're doing, March of Dimes is doing a lot of work with, they're the lead on a collaboration of about 80 organizations advocating with Congress to pass Zika prevention funding. And so hopefully we'll see some movement on that when they come back into session after Labor Day.
Right. Now, our representatives come back to Congress right after Labor Day sometime, and there is legislation before Congress right now. It's tied up because of some amendments that were added to it. But I'm sure you're very involved at March of Dimes in getting in there and lobbying and making certain that they do act on this.
Yes, yeah.
Now, because before you know it, it takes one trip to Miami, one trip to Puerto Rico, and you come back and all of a sudden it's in our region. Prevention being the best medicine, right? Understand the symptoms. If you feel you have the symptoms, if you feel you're particularly vulnerable because you're pregnant or be married to a pregnant woman, please, pay attention.
And stay home if you
attention.
can.
Yeah.
We
Yeah,
would encourage
yeah,
folks
gotcha.
not to travel to these areas where it's endemic if at all possible.
Yeah, I've got it. Kathryn, Jennifer, thank you very much for coming in and bringing your expertise.
Thank you.
Thank you.
Very nice to have you. Thanks.
Thanks.
To see this interview again, you can head to our website, looktvonline.com. Good.